it's life as usual. We try to keep you as normal as possible. You've got cancer, life does not stop. Chemotherapy, you try and stay as close to your normal life routine as you can. The same thing with the port, accessing the port. As long as you do not have a needle in your port, it's life as usual.
When we access your port, you're going to notice that we use sterile gloves. We do it sterilely. We have a special antiseptic cleaner. It looks like a sponge. We'll squeeze it and we'll scrub around the port site. We're going to be scrubbing the connection site where our syringe goes. We're going to be scrubbing it very vigorously with alcohol before we administer any medications through there. That's very important, as well as great hand washing. If you notice anyone not doing that, it is okay to say, "Can you stop? I noticed you didn't scrub the hub or clean off the port before you're administering my medicine. That puts me at risk for infection." You are your best advocate. So if you notice anything, you notice someone not washing their hands, someone not scrubbing the hub before they administer medication to you, it is certainly okay to say, "I noticed you didn't wash your hands. I noticed you didn't scrub that hub. Would you please do that, because I want you to help protect me." Another way to help prevent infection is, once we have it accessed, we'll put a dressing on there to prevent anything from getting around that port site. Another important way to prevent infection is minimizing the number of times that we enter the port. So we really want to use it mainly for the administration of your medicine. When you need labs, we would prefer to use a vein in your hand or your arm. That will be important in, entering the port less and helping to prevent infection. Your port is a very important part of your treatment plan. It's, one of your lifelines, so to speak. Ports can, because there is blood going through, they need to be flushed out to keep them open, able to flush. We need to be able to draw blood from them. So we recommend that you come in every 6 to 8 weeks to have the port flushed. It's flushed with saline and heparin. Heparin is an anticoagulant that helps the blood from clotting, to help keep a clot from forming around that the tip of the catheter. So it's very important to have it flushed, and quite honestly, it takes longer to get out the materials to do it than it does actually to do the procedure itself. So you're looking at a quick in and out trip to our office. Sometimes when some people come in to get their port accessed for treatment, we'll flush it, and we can flush it, but we can't get blood back. So it's nothing to worry about. It does happen. What that means is sometimes there can be a collection of blood at the tip of the catheter, or some fibrin, which forms like a little flap. So when you flush it, the flap opens, and you're allowed, it flushes easily. When you draw back with the syringe, that flap closes and you're unable to get blood. So we take, very important care to get blood, especially when we're administering medications. So we want to make sure that that port is open and easily give us blood. So if that ever should happen, it's nothing to panic about. We have a medication that we can place in the port that will dissolve that little collection of blood or fibrin. It takes a little time. We usually let it sit for about 45 minutes to an hour before we check it, and it dissolves that, and usually we get blood back and it's good as new. So it's nothing to panic about.